Thanks again for tuning in to Future Medicine. I'm your host, Dr. Dave, and we are going to talk about a little deep dive on MDMA today. Again, that's 3,4-methylene dioxymethamphetamine. It's a medicine that is currently in phase 3 trials with the FDA with breakthrough status. And interestingly, MDMA is actually the closest thing to a cure for a mental illness that we've ever had. We've never, as a psychiatrist, as a therapist, and as a neuroscientist, we have never really had medicine in mental health that has had the possibility of inducing what we call a cure for a mental illness. When we talk about physical illness like infection, for instance, you can take an antibiotic prescribed by your doctor, and when used properly, many of the infections that we have can be treated effectively and what we call cured with the assistance of an antibiotic, which facilitates the healing process. However, in mental and emotional illness, we have had a really hard time developing any kinds of treatments that have been anything close to what we would call a cure. MDMA could be one of the first medicines of this variety that can actually fit into that category of cure. So let's talk about that and why that is. So as we mentioned in the last episode, MDMA is a molecule that was one of the first of its kind to be discovered that radically induces empathy, self-acceptance, non-judgment, self-gratitude, and it facilitates these incredible connections between ourselves and our mind and our bodies that facilitate healing experiences, particularly from trauma and PTSD. So MDMA has been in FDA trials for some time, and the phase 2 trials of MDMA showed some really incredible results. These trials were sponsored by and operated by MAPS, the Multidisciplinary Association of Psychedelic Studies. It was founded by Rick Doblin in 1986. And they have just done some incredible, diligent, and rigorous scientific work to show that when MDMA, when used properly, can create and induce dramatic healing responses in people who have had PTSD that don't respond to any other treatment. As a psychiatrist working with people with PTSD, this is probably over 50% of the patients we see and the clients we see are not responsive to the treatments that we are told or taught to provide. So MDMA is a welcome opportunity to be able to help people who don't respond to regular treatments and also to change the direction of how we approach PTSD treatment in the future. So looking back at the 5-year reports from the phase 2 trials with the FDA that MAPS ran with MDMA, what was found was that with just 3 doses of MDMA and 12 weeks of psychotherapy, we saw that people who had treatment-resistant PTSD, who were mostly military veterans, who had 17.6 years on average of treatment-resistant PTSD, after just 12 weeks of psychotherapy and 3 doses of medicine, over 50% of these people were symptom-free or no longer meeting diagnostic criteria for PTSD 2 months after the treatment was finished. What's even more impressive is that 5 years after the 12-week session was finished, the 12-week treatment program, 5 years later, 67% of these subjects were still no longer meeting diagnostic criteria for PTSD. This is really incredible because typically what we are told in Western medicine and what we're taught and what the data shows with SSRIs, for instance, serotonin reuptake inhibitors, Zoloft, Paxil as 2 examples that are often used for PTSD, is that if people stop taking these medicines, they tend to relapse or have the recurrence of symptoms. And if they stop going to therapy, the same or similar things can happen where the symptoms come back. However, MDMA is really showing us a new paradigm for the treatment of mental illness. With just 3 doses of medicine and 12 weeks of psychotherapy, we are seeing that people who have had completely treatment-resistant PTSD for over 17 years are continuing to get better over time without subsequent significant interventions. They're learning, in other words, they're learning using the medicine and the therapy to activate what we refer to as their inner healer or their inner healing intelligence, the part of all of us that knows how to heal itself. And so what psychedelic medicines like MDMA are really doing to change the game of the way we treat mental illness is they're showing us that there are other approaches than the standard take one medicine or multiple medicines every day for the rest of your life or you'll never get better or feel better. What we're actually seeing is medicines like MDMA and ketamine and psilocybin are in a similar vein, is that when used properly in the clinical setting, we can induce long-lasting benefit because we are using the medicine to teach our clients, our patients, how to heal themselves more effectively. So this is a really exciting future for mental health because up until we started seeing these FDA trials with MDMA, we have never really had medicines available or tools available like this to us as mental health providers that we could bring to our clients. So in terms of future medicine, MDMA is certainly one of the most exciting things on the horizon. So stay tuned for more.